You're listening to the RN Mentor, a podcast designed to document and bring you the work and experience of some of the most influential nurses in our profession. We will be sitting down and having a discussion with the leaders of today's nursing world as they share their work, how they navigate their nursing path, and their views on the future of the profession. My name is Ali Tayeb. I am a registered nurse, United States Navy veteran, a Jonas Veterans Healthcare Scholar, and your host for the RN Mentor. Hello and welcome to another episode of the RN Mentor podcast. We are being joined today by Dr. Lindsey Harris. Dr. Harris began her nursing journey at Samford University, where she received her Bachelor of Science in Nursing and a minor in business. After earning a BSN, Dr. Harris received her MSN with a concentration in family practice and her Doctorate in nursing practice from the University of Alabama at Birmingham School of Nursing. Dr. Harris has worked as a family nurse practitioner at the University of Alabama at Birmingham Medicine and as an assistant professor at the UAB School of Nursing. Dr. Harris is the youngest and the first person of color to serve as president of the Alabama State Nurses Association in 107 years. She has presented extensively on healthcare disparities, access to care, mentorship, mental health, and nursing advocacy issues. Proficient in Spanish, Dr. Harris helped to manage COVID-19 vaccine sites, improving access in Hispanic communities. Dr. Harris was named an Alabama influencer and was featured on billboards, media posts, and mailers statewide. Dr. Harris has also been recognized by her colleagues and received awards from the National Black Nurse Association at the National Black Advanced Practice Nurse of the Year and the National Black Staff Nurse of the Year. She has also received the Living Legacy Award from Samford University and the Joanne Barnett Compassionate Care Award from the University of Alabama at Birmingham School of Nursing. In 2023, Dr. Harris was recognized for her contributions to the nursing profession and inducted as a fellow into the American Academy of Nursing. Dr. Harris is currently completing a fellowship in health policy with the Robert Wood Johnson Foundation. As a public servant in the House of Representatives, Dr. Harris serves as a legislative fellow in Representative Lauren Underwood's office, working towards advancing women's health equity worldwide. Welcome to the show, Dr. Harris.
Well, thank you so much for having me. I am so excited to be here.
Well, I'm excited to have you here. We've known each other, or we've ran into each other a couple of times over the last couple of years. So I'm so glad we finally got a chance to get you on the show. And for our listeners, just so you know, I condensed her bio. There's a lot more in there. So please check out the website for her full bio. I always don't do my guests justice because I shorten their bios and leave stuff out. But I want to have time to speak with you. So having said that, we'll start with my normal question is, how did you get started in the world of nursing?
I think forever that I can remember, just even as a child, I've always had the heart to give and to help people. I can remember as a little girl asking my parents to, if I saw those without, I would ask them, can we give them money or food? And then just growing up, just my family, just seeing my family and how they share and care with others. I think it was really honestly just innate. And I'm giving this background because that's what I think the nursing profession is. It's a holistic profession that, treats the individual as a whole in its entirety or holistically. And, nursing was the perfect opportunity for me to be able to live my true passion. And so I went to college. I went to Samford University. I was a college athlete, and it was very difficult at the time, but nursing was just the right fit for me.
Excellent. What was the process for you when you said, I'm going to go into nursing school? What was your experience like in nursing school?
Nursing school was actually difficult for me. And I'm glad you asked this question. I talk to students, I mentor a lot of students today, and I think people look at me and see, where I am now and think, oh, it was easy for her. But I will say this, and this is probably the first time I have admitted this publicly, maybe. I mean, I tell my students, but when I was in school, in the nursing school, I really had a hard time. So those of you all who are listening that are nurses, who have been through nursing school, you really understand that when you take a nursing test, we know that all the answers are right on the test. You have to select the most right answer, which was like so difficult to me. And you have to like critically think. And I was unsuccessful in my foundations course.
Mm,
I was unsuccessful in my foundations course, and I ended up having to sit out a semester.
wow.
Now, while I sat out that semester, I did get a business minor, but so I didn't, just leave. I continued to play basketball. I got a business minor, but it was very difficult for me. I did a lot of studying, taking my books to the men's basketball game, studying before our practice, study groups, even receiving tutoring. And so, it was difficult. It was a great journey for me, though, because Samford University was so nurturing. And, obviously, I had a lot of mentors while I was in school, joining professional organizations, which also helped me. So it was a difficult journey, but I would not trade it for anything.
Wow. Well, thank you for sharing that. Yeah, that's one of the things that people don't always necessarily understand is how nursing school is a different beast of its own.
Absolutely.
But at the same time, I don't want to like normalize like people not being successful in the program, but we have a number of, or I at least know a number of people that have struggled through nursing school, and it wasn't easy for me either. I was coming back from being away for like 10 years, so going back to college was very challenging and trying to get back in that study mode. And how do you study? And then nursing has its own method of studying for the NCLEX exam. So yeah, it's very challenging and people struggle, but there is light at the end of the tunnel and there is success there. So it's just a matter of um, a good friend of mine's mom always says the difference between people who make it and don't make it is the fact that the ones that make it just don't quit. Just don't quit.
That's exactly right. And you know what? I do talk to my students and I tell them, it is honestly, I've never had a patient to ever ask me, what grade did I make in foundations? What grade did I make in patho or pharmacology? I've yet to have one. And I can tell you that, I've been charge nurse, assistant nurse manager, in leadership roles in nursing. So, it was worth it for me.
Oh, that's awesome. Now you moved on to your and have moved on and you've gotten your master's and your doctoral degrees. What influenced you that you said, you know what, having a master's degree is just not enough? What else did you want to do that you went ahead and you did those additional? Uh,
Yeah, honestly, I think my initial thought was with the doctoral degree that I wanted an end degree.
mm,
And I am heavily focused on practice and improving outcomes for our patients. And so the DNP, the Doctorate of Nursing Practice, was based upon the best evidence and utilizing the best evidence in practice for our patients and for our institutions. And so that really just seemed to be the right fit for me. As a nurse practitioner, I've always, wanted to be that provider that was able to sit, talk with the patients, and not really just be there to prescribe a medication. Like I wanted to talk to them about, so let's dig deep and understand the social determinants of health and why why are we not able to get our blood sugar down? Like, what are the issues? Is it stress? Is it, food, or the lack of access? So I've always just been interested in that and wanted to be able to just to have the opportunity to impact my patients in that way.
Very cool. Um, so knowing a little bit about your work, uh, what drove you towards not only like your doctorate, but you've actually taken like a sort of a policy turn where you've engaged with nursing organizations. You were president of the Alabama Nurses Association. What was it that you kind of went towards the nursing component from a policy perspective, right? And right now you're doing your fellowship or actually you just completed your fellowship
Right.
with the Robert Wood Johnson Foundation. Kind of what was your path? What led you to go down that path?
Yeah, I think as nurses in general, in nursing school, we are always taught to advocate for our patients.
Right.
That's what we're taught, right? To be the voice for our patients. And it was when I became the president of the Alabama State Nurses Association during the height of COVID, and understanding that nurses on the front lines in the state of Alabama did not have the things that they needed. Nurses across the country, it was very difficult because nurses didn't have the PPE that they needed. The staffing, they didn't have the staffing. So it was during that time that I was working as a nurse practitioner, seeing patients myself in the hospital, but also representing our 97,000 nurses in the state of Alabama, and being the voice for nursing and really advocating for nursing and saying, like, nurses need PPE, nurses need, some patient safety, or they require or desire patient safety or adequate staffing, I should say. And so to be able to do that, it really opened up another lens to say, number one, we are always advocating for our patients, which is what we're there for, but who advocates for us? And
Mm,
so I think that just really opened up another lens or another avenue for me to say, you know what, I really want to learn more about this advocacy role and how I can be at the table and not on the menu.
right. Right. Which is really incredible insight because unfortunately some of the nurses that I see out there, it's the 9 to 5, right, or the 7 to 7 job component. So we don't have a lot of nurses that actually engage in how can I engage in the profession of nursing beyond my role. And I think that's what you did is you engaged in the profession of nursing and became an external influence that the profession needed. And I think that that's commendable. So thank you for that. So thank you for your insight. Was there anyone while you were doing that, was there anyone you reached out to or said, how do I do this? Was there anything in place that kind of assisted you, or was it like on the job training of how to do this? Because I feel like I know the answer to this.
Absolutely not. Now, do I have mentors? Absolutely. Both at the local and the national level. But I will say this, I think the quick, on the job training, or in the height of it training, really came one. And it's so funny that you asked this question, because I was on the phone with he was our executive director at the time, Dr. John Ziegler. And I just called him to ask him a few things. But I started off the conversation by saying, I really appreciate you during my presidency, because he was in his, prior to being our executive director, he was in PR. I think he worked in just in other capacities, but, very good with speaking to the media and helping me to identify 3 most important points, sticking to the points, not deviating. And so that really, I was a little bad at the beginning, but as more interviews that I would do, I became better and better. And I promise you, I would literally call him like 5 minutes before and say, okay, so remind me of what I'm talking to, because I'm literally going from a patient's room, taking off PPE, and then finding some clean room to do an interview. So I think that really helped me to really find my voice and to feel confident into what I was saying. But being in professional organizations and joining the Black Nurses Association, the American Nurses Association, like all of these nursing associations really helped me to understand what nurses need. And it's easy when you truly understand, the community that you're advocating for and what they need. It's easy to articulate their needs.
Yeah, that's fantastic. Now you applied and clearly you were accepted in the Robert Johnson Foundation's legislative fellowship program. What made you explore that route?
So that's another funny story. One of my a fellow member of the Birmingham Black Nurses Association, Victoria Smith, I will never forget. She's definitely a night owl, so I can remember waking up one morning at 5:30, about to go to work, and she sent me a message saying, "This is your next move." And it was the application to the Robert Wood Johnson Health Policy Fellowship. That was, let's say that was in, the end of the year, so November. That very next year, Dr. Greg Margolis, who is the director of the fellowship, came to a National Black Nurses Day on Capitol Hill, and he spoke about the fellowship. And I immediately said, you know what, God, I know this is for me, because, Victoria sent it to me. I was like thinking, oh my gosh, I'm definitely going to do this. I'm definitely going to apply. And then here comes Dr. Margolis to speak about it. So of course I went up, shook hands with him, and, introduced myself, and, it's history after that. But I think this program is such number one, it's an immersive program that brings you to Washington, D.C., our nation's capital, for a year to have the in-depth, education, real life experience of how Congress works. And it was an amazing experience. They talk about in the fellowship, like getting Potomac fever. Just truthfully to the audience, I'm still in DC. My fellowship ended in December, but I'm still here. But going back to Alabama, but I would say I definitely will miss it, because it's such a great place. So much opportunity here. And I have learned so much just being on the Hill in the office of Representative Lauren Underwood.
That's fantastic. Now I know with Representative Underwood, she has been doing a lot of work with the women's health equity and the Momnibus and that kind of work. How did your work or how were you able to contribute and learn during that process and align to the work that she was trying to, or she still continues to try to push forward?
I think the one thing that we do as fellows when we apply, and when we are introduced to the offices that we're going to work in, is we have the understanding that we come to essentially be as a legislative fellow. So we are here to not necessarily provide our opinions or our thoughts. We are here to, do research, to provide support for the health staffer or any other portfolio of hers. So I have definitely had the opportunity to, start creating or think about different concepts of maybe how will we utilize what we do here at the federal level and expand it to the states. I've had the opportunity to look at just different opportunities for or different bill ideas within the maternal health space or within the WIC space. So there's so many opportunities that you have. I've had the opportunity to meet, which was my favorite, to meet with constituents from the district and from just across the United States to come and advocate and tell me how much they love Representative Underwood, but to advocate on their particular issue or their patient population, and that has been very rewarding for me.
Wow, that's great. For somebody who may be looking at, by the way, quick side note. Greg Margolis, is this the same one from like Duke University, the Margolis Institute?
Oh,
or is that something different?
Right. I don't think Greg is. If he is, he has not told
is there,
me.
Okay, all right. I'm like, is that the same? Because it's like it has the same name, so I just had to throw it out there. Because that institute's names popped up like a bunch of times over the last couple of weeks. So I'm like, I wonder if this is the same. So all right, my audience is like tuning out at this point for my side inquisition. All right, so for somebody who is actually looking to get involved in, for example, on the policy side of the house, right? Or looking at maybe in a position where they might want to apply to the Robert Wood Johnson Foundation Fellowship, what do you think is a good prep for somebody who is interested and just doesn't know if they're ready or if they're not ready, or any advice?
Yeah, there's lots. So let's start with the number one is just how to get involved in policy. I mean, there are so many ways that one could get involved. Number one, be curious. And I say that because many of our bills or our legislation comes from someone asking the question, why do we always do it this way?
Mm.
And then identifying another way to do it or a better way to do it. So I think that is number one. There are so many ways that one can get involved in policy. Number one is joining your professional organizations, donating to the PACs within political action committees within those organizations. That within itself is extremely important because a lot of times these organizations will donate to the campaigns of a particular elected official or soon to be elected official, which helps them to win. So the money aspect is very important. Going on the Hill, coming and lobbying and speaking on behalf of your organization or your profession or your particular population is a part of, impacting legislation and laws. And really just keeping in touch with your local legislators. A lot of the issues that we're dealing with today is really at the local level. And so being, involved and truly understanding why we vote, what we vote for is very important. And lastly, my favorite is run for office. I think that being an elected official, you can be on the local school board, the local city council, a county commissioner. Nurses, and healthcare, I should say, healthcare truly transcends and impacts everything that we do. It impacts transportation, education. So I think that, every board, every office, or at least some offices should be staffed or elected with nurses, because nurses are just great. So to your next question about, deciding if you're ready. Yeah, I think there's a lot of different things that the fellowship looks at to identify the readiness of a candidate. Number one, you have to be a mid-career, or it just states mid-career person that has been, so someone that has been in whichever field dealing advancing healthcare. Also, I think I would say have demonstrated impact like in your area, but also has the capacity to learn and to grow.
Mm.
And with the desire to learn and later to improve health outcomes for your state, your city, your country. So, I'm willing to talk to anybody. You can look me up on LinkedIn, just about just the preparation for the Robert Wood Johnson. I think it is such an amazing program. I really appreciate this transformational experience that I've had. And so if there's anybody I can help, I would love to.
It's fantastic. Yeah, I mean, it's a fantastic program. Actually, I looked into it a couple of years ago and I saw you have to move to DC, and I'm
Yeah.
like, well, that's a barrier.
Yeah.
As you mentioned, there's different ways that you can get involved and get similar experiences locally, so you don't have to, pack your things up and move to DC. But it is a very unique experience, and I'm glad that it's sponsored and made available. So thank you for that. Now, since you're finishing up you have finished up your fellowship, um, what do you think you're going to take back to Alabama, uh, based on your learnings at DC, and what do you think your next steps are going to be?
Number one, I am currently an assistant professor at the University of Alabama at Birmingham School of Nursing, and I am teaching or coordinating the health policy course for doctoral and master's prepared students.
Excellent.
So I do have the opportunity to really just like teach our students the wonderful things about policy and how they can, get started within policy, at their local level, but also at their federal level. So I love doing that and really impacting our next generation. So that is one. What would I bring back? I think one of the things that I have seen here is, or really understand more, is the art. I don't know if this is the right term, but I'm gonna use it. I'm gonna say the art of negotiation and being able to work in a bipartisan manner in order to improve outcomes for those that we serve. And that is really one of the things that I would love to bring back to Alabama, because I think that in any instance at the local level, at the in our city, but even within the state, I think there is room for improvement. And so I would love to have an impact in that capacity. Of course, I'll continue to work with, I'm a member of all the organizations, Delta Sigma Theta Sorority Incorporated, the Black Nurses, Birmingham Black Nurses Association, Philippine Nurses Association, Hispanic Nurses Association. So I'll continue to work, Alabama State Nurses Association. I will continue to work within those organizations and really like lend my knowledge and that I've learned at the federal level, and continue to learn and gain more at our state, at our state house, and to see how I can help to improve and move Alabama forward.
Thank you for that. Now you mentioned something, and the art of negotiation and working in a bipartisan manner. Um, Having experienced Washington over the last year, and the country being so divided, this is not a political show. But what can the nursing I'm going to switch this question up a little bit. What can nursing do to be more effective? Because sometimes we are ruled or governed by a Republican legislative body. Sometimes we're governed by a Democrat legislative body, but I don't think. And nursing has, just like the rest of the population, we have all kinds of political affiliations. So what can nursing do better? Because even from the American Nurses Association perspective, I think I heard like there's like one lobbyist for on the Democratic side, one lobbyist on the Republican side, and that's all the lobbyists that we have, and we're competing with all these like mega organizations that have like busloads of lobbyists that dump out in front of the Capitol, right? So what can nursing do better uh, to get its message across where it is palatable for both for regardless of who's in office?
Yep. A couple of points. There are 3.7 million, I believe, do not quote me on that, but 3.7 million nurses in the United States. Imagine if we all were on one accord and were able to join, you just mentioned ANA, American Nurses Association,
Right.
donate to the PACT. Our political influence would be unmatched. That's number one. The one thing that I do know, and I see this, and everybody knows this, we are all here for one reason. Whether you're an elected official, whether you're a nurse, we are here for the constituents or the people that we serve. And I think if we continue to keep that and not vote political party, but we vote based upon the needs of those that we serve, then I think that is one way that we can come together and be a political force. I would love to see all nursing organizations come together under one umbrella and really show their power. We back one organization and we show our power with our voice, with our finances, because nurses, we are mothers, we are fathers, we are parents, we are students. I mean, we really touch every avenue, and we can influence every avenue. And we just need to have one voice. So for the individual nurse, join your professional organization. Even if you're not active in the professional organization, joining and even donating to the PACs or donating to an elected official that you feel, that is really connected or has the patient best interest at heart, I think, or the individual's constituent best interest at heart, I think is top of mind for me and extremely important for us to move nursing forward, but also to move our country forward.
I appreciate that. Thank you. Thank you. And very true. I think if more individuals were members of the professional organizations, I think we could make a bigger difference. And I know we have a number of organizations that have days at the Capitol from the state level to to the national level. So I think that engagement is important. One last question, well, two last questions for you. One of the things I want to ask you is from your perspective, is nursing or nurses of color represented with the American Nurses Association? Because I know they've put out a number of statements over the last year, and but if you look at the makeup of a lot of the organizations, they still continue to be very white and female. Even though we're pushing diversity, and hence a lot of the other organizations that exist are primarily because they don't have necessarily representation. What can nurses do to become to diversify our nursing organizations other than join? What do you think would be your call to action from to the nurses that are minoritized within the profession?
That's a very good question. Your first question was, do you feel like the nursing organizations are, diverse? And I would definitely say no, but I will say this. Dr. Martha Dawson, she is the immediate past president of the National Black Nurses Association. She has said several times that if you would take, and I'm going to use Black nurses, for example, if you would take all Black nurses and put them in the state of California, the state of California will still have a nursing shortage.
Yep.
Because there's not that many, right? So number one, let's talk about the pipeline for nurses.
So true.
And not to keep mentioning the National Black Nurses, but they have created a mini nursing academy that addresses the pipeline. They go into elementary schools to introduce these students, and this is in underprivileged, underserved areas. So where there's a mix, it's a diverse population in these areas, and they introduce the students to nursing, to healthcare in general. And there's going to be a longitudinal study. They're going to continue to eventually follow these students, but it's such a great program really to look at the pipeline. So we have to improve the patient provider concordance and really try to get more people, more diverse people, more men into nursing. So it has to be very intentional. And we have to start again looking at the pipeline right now.
Yeah, I appreciate that. And very true. We're very true. I think we start too late to introducing nursing as a profession to the population, period. So thank you for that. I want to be cognizant of our time, and I know you have a hard stop because you're a busy woman. So any last words for our audience before we sign off?
Number one, I want to thank you for this opportunity. I think this is your podcast is amazing. And so hopefully, for those of you all who are listening, if you're listening for the first time, share it with a friend and have your friend share it with a friend. That would be greatly appreciated. And, I can say that one of the quotes that I use, I just recently created a presentation for the Alabama Nurses Day at the Capitol. And I put on the slide that those that are closest to the problem are closest to the solution. Mm-hmm. And when I hear that quote, I think about nursing. Nursing, we are there from birth to death. We are in the communities, we are in the schools, we are in the hospitals. Nurses, we touch really every aspect of everyone's life at some point. And I just feel like we as nurses need to recognize our value in that and become, better spokespersons, better advocates for ourselves. And that's all I have to say, because I could really keep talking about it.
No, I appreciate that. Thank you. And I appreciate your time. And just something that I think I just need to mention really quickly, that the fact that you worked with Representative Lauren Underwood, she is also a registered nurse, one of two, I want to say, that's serving at this moment.
That's exactly right.
So we definitely need more representation in Congress. So nurses, if you're listening, you have any interest, you know who to contact. Not me, right. Dr. Harris. Dr. Harris. Contact Dr. Harris on how to get involved in politics. All right. Well, greatly appreciate your time. We have been listening to Dr. Lindsey Harris, and good luck with you. And I'm going to hopefully get to see you again soon at a conference. I'm sure our paths tend to cross at least once a year. So
absolutely.
Thank you so much for being here. And I look forward to bringing more incredible guests as this season moves forward. Thank you. You've been listening to the RN Mentor with your host, Ali Tayeb. Please don't forget to visit www.alirtayeb.com. That's www.alirtayeb.com for podcast notes and resources, and don't forget to subscribe. Until next time, I wish you fair winds and following seas.